Hi everyone, my name is Lisa Majeski and I'm the president and owner of Gold Star Medical Business Services. We are here today as part of the task force that is going to be helping doctors of chiropractic throughout the United States and medically integrated practices respond to the public health care crisis that's going on right now as we speak with the coronavirus. And of course, all of us, I'm sure, are very aware of what is going on in our country with respect to the coronavirus, the dangers that it poses to our public health, and how many of us in the healthcare industry are wanting to respond to that by increasing safety for our patients and at the same time preventing our practices from suffering extreme financial loss as a result of patients staying away due to the self-quarantines that many of us are doing right now to help prevent the spread of this virus. And so we have to start thinking differently. And I'm so honored to be part of this symposium that is going on now to help us understand what is going on with the coronavirus, what the ramifications of all that are, both financially and as far as our patients' health and our patients' well-being and safety. But I'm only going to be talking and playing a very small part in this and helping you as providers understand what some of your options are with respect to your patients and how you can treat them when they possibly can't come into the office. And so we're going to think a little bit, we're going to not just think outside the box, but we're going to expand your box and help you understand that you have a lot more choices and a lot more possibility than you may think you do when it comes to treating your patients. So we're going to work very quickly here. I'm going to try to do this in about 30 minutes, and I hope that the information that I provide you is extremely beneficial to you and that it will, at least if nothing else, give you some things that you can think about and some things that will help you improve and grow your practices during this very difficult time. I call this expanding your box, and what we're going to be talking about today is telemedicine. And so let's go ahead and get started and see if I can get my screen to go. Here we go. So, you know, many of us in the industry think about our practices and we think about what can we do to improve the problem that we're having with excessive cancellations. What can we do to improve or to counteract the issues of our patients who can't come out anymore and cannot have to stay at home because of their healthcare situation and because they're at-risk patients due to their age and the likelihood that if they did contract the coronavirus, they could possibly get gravely ill and maybe mortally ill, and we certainly don't want that for our patients. So what are we doing? I'm hearing a lot of things. I deal with chiropractic offices and medical offices throughout the United States, and I talk to hundreds and hundreds of doctors each month about their practices and about the challenges that they have with their practices and help them with their practice growth. And so some of the things that I'm hearing are things like we're encouraging our patients to keep coming, and we're letting them know that we're taking all the extra precautions of sanitation. We're spreading them out a little bit farther. We're having a patient come in every 10 minutes. We're not letting our patients sit together in a reception area. We're spacing them out and having them go straight back to the treatment rooms. I've had some doctors have the idea of taking all of their elderly patients and maybe scheduling them only at a certain time, like a Saturday morning, where no other patients are coming in that could put them at risk for infection. I think actually, you know, all of these ideas that doctors are talking about are good ideas to keep patients coming into the practice and to keep those patients who possibly are not at the higher end of the risk pool to come in for their visits and continue with their treatment. Some doctors are saying we're not allowing any patients over 60 in the practice until this crisis is over. And some doctors are saying, well, we're going to have days where we just give away our services to encourage patients to keep coming in and help them understand that it's not as dangerous as they may think it is. And again, all of these are just ideas, but what that is it's kind of staying inside of our box. We're thinking about ways to treat our patients in our offices. And we have to, in light of this crisis, we have to start thinking differently. For us and in my company, one of the things that we do and one of the main products we offer is medical billing for doctors and chiropractic offices all throughout the United States. And we have about 80 clients that we do billing for and consulting and so on and so forth. And one of the things that that we have done all of it since our business is open is all of us work remotely. And so when this crisis unfolded, we as a company really didn't have to make any changes to the way we do our work because we already have been working remotely for many, many years. I haven't worked in an office setting in over 20 years and have worked from a remote office location or my home. So, but for some of you, this is all very new and very disconcerting. You know, you may think, well, you know, how can I have a front desk CA even at the office? And you know, you can forward phones to your CA and they can log into your system remotely from their home and have access to your software. And if you were to forward the phones to your CA at home, they could schedule patients, take calls, do recalls, and a whole bunch of things. And so it's not just the patients that we need to think about as far as their safety goes, but also your employees. And so you may be able to work with it literally with a skeleton crew, no pun intended, chiropractors, but you know, you could work with a skeleton crew in your office and send a lot of your administrative workers home to do their work by using technology. And so we're going to talk about how we now can use technology to actually treat our patients. And this is actually very exciting stuff. Now, telemedicine has been around for a long time. And so, you know, the last thing that we want to do is close our doors, you know, and some doctors are actually doing this. Unfortunately, we've gotten calls from some of our clients saying we're closing for 2 weeks. And part of that is because they are practicing in what is known as hotspots for the coronavirus. And there are mandatory closures going on for them. So they're having to actually close their doors for a few weeks. But does that mean they have to stop seeing patients? And the answer is no, they can actually continue to see patients virtually. And so, you know, we have to respond to this problem and we have to respond to it very, very quickly. So when the patients can't come to us, what we want to do is we want to make our box bigger. And by doing that, you would go to them virtually. And there are three concepts that we're going to talk about today in this presentation. One is telehealth visits, and then another one is virtual check-ins, and the other one is e-visits. And they're all slightly different. And it's important for you as providers to know what the differences are between telehealth visits, virtual check-ins, and e-visits. And we're going to talk about that. And we're going to talk about some of the codes that you can bill for through telehealth and some of the codes that you need to use for the virtual check-ins and for the e-visits. 2 days ago, March 17th, today is March 18th. And so today's March 20th. So 3 days ago, March 17th, CMS published a fact sheet outlining an expansion of telehealth services to meet the needs of Medicare patients during the COVID crisis. And so this is brand new legislation that has come out. I'm going to talk to you a little bit about the highlights of this legislation and how it is impacting our practices, because there are certain services under telemedicine that up until a few days ago, we could not do as a profession, or even normal medical offices could not do. In prior to March 17th, telehealth was only available to rural practices and under certain conditions. And so now these conditions have been broadened and have been and rules have been relaxed to allow more patients to be able to receive telehealth services. So what you see here on your screen is a screenshot of the fact sheet that CMS put out about Medicare telemedicine health services. Now, we're going to be talking about telemedicine in respect to Medicare. We will also discuss it with respect to our commercial payers as well. But in order to understand how telemedicine works, we have to understand the Medicare rules, because those are the rules that govern telemedicine in general. So even if you don't see Medicare patients, you need to know what these telemedicine rules are and what the legislation is that govern telemedicine services. So what you're seeing here are excerpts. This is copied and pasted directly from this press release from CMS about the relaxation of the rules for telemedicine. And what it says is, under President Trump's leadership, the Centers for Medicare and Medicaid Services, or CMS, has broadened access to Medicare telehealth services so that beneficiaries can receive a wider range of services from their doctors without having to travel to a healthcare facility. And you'll see, as I go through this presentation, you'll see that I have links to the different sources for this information. So the information that you're receiving from me is not opinion. It's not what I think is going to happen or what I think should happen. It is what the legislation is telling us right now. Okay. So the next thing that this communique said is that CMS is expanding this benefit on a temporary and emergency basis under the 1135 Waiver Authority and Coronavirus Preparedness and Response Supplemental Appropriations Act. So please understand that at this point in time, this is going to be temporary until the national emergency, until they revoke the declaration of it being a national emergency. The benefits are part of the broader effort by CMS and the White House Task Force to ensure that all Americans, particularly those at high risk of complications from the virus, are aware of these easy-to-use, accessible benefits that can help keep them healthy while helping to contain the community spread of this virus. So under the new waiver, Medicare can now pay for office, hospital, and other visits, and this is important, furnished via telehealth across the country, and including in patients' places of residence, starting March 6th of 2020. So we are now just a week or two into this authorization to use telehealth services, and that patients can receive telehealth services from their homes. Prior to that, that was not possible. There were certain things that they could do at their homes, but not telehealth services. So prior to this waiver, Medicare could only pay for telehealth services on a limited basis when the person receiving the service is in a designated rural area and when they leave their home and go to a clinic, hospital, or certain other type of medical facility. So prior to this expansion of telehealth services, what would happen is a patient in a rural area would go to their rural health clinic. The rural health clinic would be considered an originating site. They would have a HIPAA-compliant telehealth equipment that a patient would dial in to, or through either video or synchronous video equipment, to a provider in an urban area who would be the receiving site. And that provider, maybe it's a specialist that is not available in their rural community, that this patient could talk to and actually do a visual inspection, a visual examination with the assistance of maybe a nurse practitioner or another provider to help and aid in that exam. And so this was a facility to facility service that took place from a rural clinic to a remote site, originating site to a remote site or a receiving site. Now the receiving site can be the patient's home, and this is where the big change is. Another big change is that the Office of the Inspector General, or the OIG, is providing flexibility for healthcare providers to reduce or waive the copays, coinsurance, and deductibles for telehealth services that are paid by federal healthcare programs. Now, of course, we know that waiving copays, coinsurance, and deductibles is a big no-no under the federal government laws, under the Social Security Act. We cannot do that. However, the OIG is saying that in light of this crisis and in light of the financial stress that this crisis has put on everybody, providers are going to be allowed to relax those copay, coinsurance, and deductible requirements. Also, the HIPAA enforcement is going to be relaxed. So effective immediately, the HHS, or the Health and Human Services Office for Civil Rights, which governs HIPAA compliance, will exercise enforcement discretion and waive penalties for HIPAA violations against healthcare providers that serve patients in good faith through everyday communication technologies, such as FaceTime or Skype, during the COVID-19 nationwide public health care emergency. This is huge because this means that you don't have to go out and purchase a HIPAA compliant synchronous video communication tool to be able to do telehealth services with your patients. So for more information on that, you can go to the Department of Health and Human Services website and look at the emergency preparedness document that relaxes these HIPAA requirements. So this is extremely important to us because now what that means is that if you have FaceTime, if you have Skype, you can go ahead and provide telehealth services to your patients. All right, so there are actually 3 different types of telemedicine services that we're going to talk about today. We have the Medicare telehealth services, we have something called virtual check-ins, and we also have something called e-visits, and they're very different. And so we need to understand the difference of these services and how they apply in our offices. So Medicare telehealth services are those services that we were talking about, that where you could actually use FaceTime or Skype, and through a video chat with your patients, you could do a consultation with them and a basic assessment of that patient while the patient is in their home. So common telehealth services include office visits, exams, 99201 through 99205. Now, interestingly enough, under the 1135 waiver, before you could do telemedicine services before the 1135 waiver, you had to have something called an established relationship with that patient. And so now you do not have to have that. So you can build new patient services and establish patient services using common telehealth platforms, okay? There are also some other telehealth services that can be used for certain things like emergency department or inpatient telehealth services, follow-up inpatient telehealth consultations for patients in skilled nursing facilities. And those codes we would probably not use. And so the 99201 to 99215 codes are on the table, as well as a list of complete telemedicine services that are qualifying for telemedicine. And we'll talk about what those services are and how to find out whether a service that you're wanting to provide qualifies for telemedicine. The next type of service is called the virtual check-in. And a virtual check-in is basically a brief 5 to 10 minute check-in with your practitioner via telephone or other communication device to decide whether an office visit or a video telehealth service is needed. A remote evaluation of recorded video and imaging could also be submitted by that established patient. Now, these codes are known as HCPCS codes, G2012 and G2010. G2012 is a review of data that a provider might do, but G2010 is the virtual check-in call itself. Now, this is a Medicare code, and what I mean by that is this code comes from the HCPCS code book, which is maintained by CMS. It is approved for billing by Medicare, but it may not be approved under your commercial payer plans. So this is something that you might want to add to your verification of benefits to see if that code G2010 and G2012 would be covered by your commercial plans. Commercial plans will cover G codes under certain circumstances, but you would have to check on that on a payer-to-payer basis to see if these codes are going to be covered for your commercial plans. Under e-visits, Now, this is something completely different. This is a communication that is initiated by your patient, okay, and the provider through an online patient portal. And these are codes 99421, 99422, and 99423. And then there are equivalent G codes for these services as well. So kind of the rule of thumb is if it's a Medicare patient and you have two codes that are exactly the same, one is a G code and one is a CPT code. If it's a Medicare patient, you use the G code. Common one in chiropractic that most of us know is G0283. So G0283 is electrical stimulation unattended. 97014 is electrical stimulation unattended. And so we know that when we have to submit a claim for electrical stimulation to Medicare, for some patients, they want to have that code billed for secondary billing or something like that. We can't use the 97014 code. We have to use the G0283 code because 97014 is not even recognized by Medicare. So that's something that you need to be aware of is what kind of a patient do you have? Are you dealing with to determine what kind of a code should you use? So you have Medicare telehealth services, virtual check-ins, and e-visits. Now, there is a complete list of other services that are covered under Medicare telehealth. You can go to this this link right here, the Medicare General Information Telehealth Codes, and I'll just show you what that looks like. If you go to cms.gov, go to Medicare, click on the General tab, and then you will see a telehealth link. From there, you can choose a list of telehealth services. I also have a complete list of telehealth services, so if you'd like to email me and get that list from me, I would be more than happy to send that to you. It's just in an Excel spreadsheet, and it's a very, very simple document that will give you the complete list of telehealth services. So be aware that not all of your services are going to qualify for telehealth. You have to make sure that you know which ones are and which ones aren't. Now, if you want to look it up yourself in the CPT code book, then what you're going to do is you're going to go to your CPT code book, look up your medical service, and you're going to look for the star. And the star next to a CPT code indicates that it is approved for telehealth. So for example, I was looking up some codes and some services that could possibly be accomplished via telehealth for chiropractic offices. And I know that a lot of chiropractic and multi-specialty offices utilize medical nutrition therapy. They have nutritional counseling. So your nutritional counseling codes are covered under telehealth because they have a star next to them. So that would be another thing that you would want to look up. Now, what can I charge for Medicare telehealth services? Now, these fees that you're seeing here on your screen I went to the Medicare website. I went to the physician fee schedule lookup tool, and I went to the national rates for participating providers. So you can look up Medicare fees for any area of the country and any locality. Now, there are certain states in which all you have is a statewide fee schedule. States like South Dakota, Indiana, will have just a fee schedule for the entire state. States like Texas, Florida, California, New York are going to have multiple fee schedules. So there may be a fee schedule for Houston, Dallas, Austin, and then the rest of Texas. And within Austin, there's, I think, a fee schedule for Georgetown. So you have to be very, very specific. You can look up your fee schedule by going to the physician fee schedule lookup tool on the Medicare website, and I have the link to that on your screen. But these are the national rates. So this is just kind of a ballpark average of what the national rates are. Your fees are going to be right around that rate, maybe a little higher, maybe a little lower, depending on the socioeconomic area that you practice in. So for example, if you're in Alaska, these are going to be pretty significantly higher by about 10 to 15%. Other areas of the country, you're going to be right around this rate. So, but just so that you know, this is what you could expect in reimbursement on the average for a Medicare patient who, if you are a participating provider. Okay. Now, if you're listening to this in your medically integrated practice, this is what your nurse practitioner would be billing for these types of exams. If you're a chiropractor, obviously Medicare does not cover exams. They don't cover anything except 3 spinal manipulation codes, but this will at least give you a ballpark of what you may see in reimbursements only on Medicare, and probably on your commercial payer rates are going to be slightly higher than this. All right, so if you're in network. So these are codes that you could bill to commercial payers, even though you might not be able to bill them to Medicare if you're a straight up chiropractic office and you don't have a medically integrated practice. So, and I know that there are going to be people, practitioners and doctors of chiropractic listening to this that don't have medically integrated practices. Definitely something that you might want to consider is medically integrating your practice so that you can expand the services that you offer your patients significantly through telehealth services. So that's just something that you could talk about to your, if you are, there are a number of great organizations that help medically integrate practices. AMI is amazing, Advanced Medical Integration. They are hosting this summit. I would certainly recommend that you check in with them if that's something that you want to do. So those were just some basic fees. Now, does telehealth, and I get this question a lot, is does telehealth pay the same as in-person visits? Now, in-person visits for Medicare, Medicaid, they will cover most telehealth services the same at the same rates as in-person visits based on your local fee schedules and your par versus non-par status. Commercial payers, however, do have discretion to pay less than their regular fee schedule, but state law does apply. There are some states, many states in the United States have something called a parity law, and what that means is that states with parity laws will have the telemedicine covered at the payer's negotiated fee schedule. Out-of-network providers could bill their fee schedule, meaning the out-of-network provider's fee schedule, and then the commercial payers would process that based on the usual, customary, and reasonable rates. And if you want more information about that, you can certainly contact me, and I'll be happy to explain that a little bit further. So here are some states with parity laws for private insurance coverage of telemedicine. I went to the American Telemedicine Association. I found the most recent map I found was for 2018. There may be some slight updates to that, so you definitely want to check to see if some of the states that are in blue now have parity laws for coverage of telemedicine. South Dakota, Pennsylvania, Massachusetts, and Alaska had legislation that was in proposal, so they may now have parity laws. And so you definitely want to check with your individual state to see if a parity law exists. If they have a stronger state parity law, then health insurance plans regulated in that state have to follow those laws. So basically it is whatever is the most stringent or the most restrictive is where those laws are. Whatever gives the best benefit is what that law would be based on the telehealth services for your area. So, so this is your map of the state parity laws. So yes, so even though your telehealth services originate with Medicare, you have to understand that commercial payers are going to cover telehealth services as well. So a key takeaway for today is always verify coverage and criteria for telehealth services and services with your telehealth visits and telehealth services with your commercial payers. Always verify benefits when you're dealing with commercial payers. So we're going to have a little fun. We're going to take a look at a case scenario of a patient who comes to you with chronic low back pain. Now you have a patient that comes in with chronic low back pain and they come into the office. You pretty much know, how many visits you're going to schedule that patient for with spinal manipulation services, possibly some rehab, some modalities. You may sell a TENS unit to them to take home. You may give them a brace and so on and so forth. Well, when we're doing telemedicine, unfortunately, spinal manipulations are not approved for telemedicine because spinal manipulations are a hands-on service that you have to perform. You can't do that virtually. And so, but here are some of the things that you can bill for. You can bill for the exam. And remember, if it's a Medicare patient, they won't pay for the exam, but these are what you're seeing here are the Medicare allowable rates, the par rates based on national standards. So again, it's not going to be exact for each one of you. These are general numbers based on a national average for Medicare. And of course, if you are let's say an out-of-network provider, your rates may be higher than that, and that's fine. But I just want to give you an idea of what you could expect in reimbursement. If you're in network with an insurance plan, they're going to pretty much use these rates, maybe a little higher than the Medicare rates, but this is just gives you an idea in a ballpark. So $46.19 for a level 2 office visit or exam to establish the diagnosis of chronic low back pain. You might deliver a TENS unit to the patient's home, and think about what it costs you to purchase a TENS unit. Medicare reimburses TENS units at $278.50 for a purchase of a TENS unit. Now, in order to bill Medicare for a TENS unit, you have to have something called a DME PTAN, meaning you have to be enrolled or accredited as a durable medical equipment supplier in order to bill durable medical equipment to Medicare. Not necessarily so with commercial plans. Commercial plans are going to be slightly different. If you're a medically integrated practice, you can usually bill commercial plans without any special certification. However, again, it's something that you're going to want to verify benefits on very carefully. Now, if you have a DME PTAN, you can bill that TENS unit to your DMERC. You can bill, let's say you want to provide the patient with a lumbosacral orthosis. This is a very basic one, flexible, prefab, off the shelf. You're going to deliver that to the patient's home. Again, the reimbursement Medicare would have for that is about $83. The patient may need some TENS supplies, some leads and batteries. You could get reimbursed about $20 for those. And then what you would want to do is you would want to provide the patient with some type of a remote physiologic monitoring device. Now, I'm going to talk about that a little bit more later, but just keep that in mind that you're going to want to think about different types of physiologic monitoring devices you can get access to that would allow you to bill for remote monitoring of the patient. And so, for example, there's a code 99453. Now, this isn't a telemedicine code. This is an actual evaluation and management code called Remote Monitoring of Physiologic Parameters, Initial Setup and Patient Education on Use of Equipment. So what this would allow you to do is if you have a remote monitoring platform, and again, they're not very expensive, but you need some type of a remote monitoring platform, then you could bill for this, and then you could instruct the patient using your FaceTime or your Skype on how to use that TENS unit, the patient education for use of that TENS unit, the patient education on how to strap on that lumbar sacral orthosis correctly so that it doesn't cut off the circulation to their back, okay? So those types of things you can bill 99453. It's about a $21 reimbursement. Then every 30 days, you can, if you are recording patient vitals, let's say you have a patient and you're recording recording their exercise program, or you're recording their pulse ox or their blood pressure or their weight. If you're doing a weight loss program and you have a remote physiologic weight loss platform that you're using, $64.15 each every 30 days. You can bill that. 99457 for monitoring treatment management services, 20 minutes or more of clinical staff, physician, or other qualified healthcare professional time in a calendar month requiring interactive communication with the patient and caregiver during the month. So CMS will reimburse for clinical staff time that contributes towards monitoring and the interactive communication, which would include phone, text, and email. The average national Medicare payment for these services is $51.54 per month. Okay, so these are all things that you can bill for in addition to just the standard office visit. Then the next thing that you could do is throughout the patient's treatment plan, you could do online digital evaluation and management services for that established patient. 5 to 10 minutes is $15.52, 11 to 20 minutes, $31.04, and 21 or more minutes is $50.16. Now, these codes are very specific, so you have to be aware of a few things if you're going to bill for these. Number one is these services are patient initiated. So this is when the patient sends you questions or queries through their portal during the course of treatment. It also, when I looked at the language on the CMS bulletin for the expansion of telehealth services, when they were discussing these codes, they were stating that these initiations of services were to be through a patient portal. So what that means for you is if you have an EMR program, but you haven't activated your patient portal, you need to do that. If you don't have an EMR program and you don't have a patient portal, it would be difficult for you to bill for these services because it's very specific, stating that these initiations of communication are through the patient portal. And the reason why they do that is because through the patient portal, it times these encounters with the patient. And what you're looking at is a cumulative time every 7 days. So these are 3 codes that you can bill every 7 days. And there are some specific rules. Patient initiated through a patient portal. These codes can be billed once every 7 days. The time is calculated cumulatively over that 7-day period. So if at the end of the 7 days, you've spent 21 or more minutes with a patient interacting with them through their portal, then you can bill out $50.16. Okay, that's what the Medicare allowable is. 99422 would be 11 to 20 minutes, 5 to 10 minutes is $15.52. These cannot be billed if the online inquiry results in a face-to-face visit within 7 days of the contact. So if you have a patient, you're conversing with them through their portal, and it's like, man, they really need to get in and get adjusted, and you set them up for that spinal adjustment, you have them come in within 7 days of that encounter, then you cannot bill for the online digital E&M service. So be aware of that. This can only be billed by a qualified healthcare provider. So this is not your CA conversing with the patient through the portal. Okay, this has to be a provider to patient conversation, and the qualified healthcare providers that are listed are MDs, DOs, nurse practitioners, and PAs. Basically, any provider that can be considered primary care. If online service is provided by a non-qualified healthcare provider, for example, PT, OT, social worker, dietitian, then you would instead use codes 98970, 71, and 72, and you can look those codes up for the differences between those 3 codes. Okay. Now, where does a chiropractor fit in? Is a chiropractor considered a qualified healthcare provider or a non-qualified healthcare provider? It actually depends. And so for Medicare, it's not covered because at all. So if you are trying to submit this to Medicare, you're not going to get paid because Medicare only covers spinal manipulation. Now, if you have a nurse practitioner, then you can bill these codes and have the nurse practitioner or the PA do the online digital evaluation and management conversations with these patients for Medicare. For commercial, these are valid codes. However, you need to know what your status is in your state. So in your state, if you have status as a primary care provider, then you can bill these codes. If you don't have status as a primary care provider, then you would have to bill the 989, 7071, or 72 codes. So that's in general, that is how you would have to decide which codes to bill to your commercial payers. So there are all kinds of physiologic monitoring services. You can get monitoring for heart rate, blood pressure, pulse ox. You can do weight monitoring services. You can do physical activity monitoring services. Some are very simple. They only need a smartphone. Some require the patient to wear a device, either intermittently to continually, and then that data is transmitted through a software platform over to you remotely. So that's how those physiologic monitoring services work. This is one that there is the Center for Technology and Aging wrote a position paper on remote physiologic monitoring, and this is becoming more and more common in the medical world, but it's just going, it's probably just going to explode onto the chiropractic and multi-specialty scene now with in response to what's going on with the COVID crisis. And so you can see all the different things that and self-management capabilities patients have utilizing remote physiologic monitoring. And so if any of these bullet points are like, wow, you know what, I can do that because I have these services, for example, nutrition, physical exercise, physiotherapy, support in daily life, and so on and so forth, you would be able to look for a physiologic monitoring software platform that could help you be able to provide these services for your patients. This is one that I, just in doing some basic research for chiropractic offices and multi-specialty offices, this was one of the first ones that came up. It's called Telespine. And you can see that this is something that is done through computers, iPads, smartphones, and it is also, I believe, a telehealth platform that you can use. It may be worth calling them to get more information, but actually, if you just Google physiologic monitoring and then base it on, like physiologic monitoring, physical therapy, physiologic monitoring, rehab, or patient vitals, it will give you a whole list of services that you can look at and research. Since this is so new, I haven't personally had a chance to do a deep dive into this, but I do plan on it. And so if you would like to get my help in helping you research some of this, again, you can call me or email me. I have, you may notice that throughout this presentation, a banner has popped up at the bottom of most of your slides with my information on it, our website, a help hotline that you can call to get more information about anything that we've been talking about, and my direct email address. So please, if anything in here is of interest to you, make sure that you give me a call. So how does an insurance company know that I'm providing telemedicine services? If I just bill these, if I bill an exam code, how do they know it was telemedicine or in person? And basically the answer is a modifier. Now, certain codes are designed for telemedicine, like the 99421 through 99423. Those codes imply that you are using a telehealth method. So in those cases, you don't need a modifier. But let's say you have other services like services that have a star next to them, the nutritional counseling or the exams. You would put a 95 modifier on your telehealth code. So you would do your E&M code, your 99212, and then put a 95 modifier on it. That lets the insurance company know that this was provided via telehealth. Some payers require a different place of service code to be 02. The typical place of service code that we use in chiropractic offices and medically integrated practices is 11, which is office. And so that varies. So check with your payer for those guidelines, okay? And that is pretty much it as far as an introduction to telemedicine. Now, hopefully I've given you all enough information to be dangerous. And just to let you know who I am, my name is Lisa Majeski. I'm the president and owner of Gold Star Medical Business Services. I've been involved in chiropractic and in medicine administration for 38 years. I started out in 1982 working as a CA in a chiropractic office in New York City. And I've had a love affair with chiropractors for many, many years and chiropractic offices for many, many years. And so I love chiropractic. I love helping you all improve your practices and continue to grow your practices. And, in conjunction with Advanced Medical Integration, who's putting on this absolutely fabulous forum, I would highly recommend that if you're needing any services whatsoever relating to medically integrating your practice, looking at becoming a supplier for DME, all of those things they can help you with. And I'm sure that their information is going to be flashed along uh, throughout this summit. You do need to contact them. They're fabulous to work with. And I highly recommend them for anything dealing with medical integration. Now, what we can do on our side is help you with the billing and the coding side of things. We have billing services, so we can do the billing for you, or we can provide you with either remote or on-site staff training services. So if you're wanting to implement telemedicine and you would like to get some training on how to do this with your staff and how to configure your practice and get it ready for telemedicine services, by all means contact me. I have certifications in coding, billing, office management and operations, chart auditing, and compliance. And if you need more information from me, please call me on the toll-free helpline 866-794-9063 for a complimentary 30-minute consultation to discuss which programs or options are best for your practice. And you also have my email address and my website on your screen. So again, thank you so much for letting me participate in this summit. I feel very, very honored. And I do hope and wish for only the best for you and your patients as you navigate this very, very difficult time. Thanks, everybody, and God bless.